And some of Thanks, Jen. So thanks everyone for having me. My name's Tanya Freirich. I'm a registered dietitian, and today we're going to be talking about good nutrition for ankylosing spondylitis. And please, as we go through, put things in the chat. We'll save those questions for the Q&A at the end. And I have a couple moments where we can take breaks and people can put in the chat some of their answers. So we'll start with one of those moments right now. I would love to hear. Out of all of you attending right now, how many of you have tried dietary changes at any point in your life, trying to accomplish something? And what have you tried?
Welcome to unmute, Tom.
Oh, I have actually tried a little bit of plain food. So, in my family, I'm known as the instant pot chap. So, and one reason is because I wanted to have something that is a little bit more plain. So I steam most of my dishes. But I do notice that when I eat plain food, like with white rice, chicken, fish, without too much seasoning, I actually do very well. But I get the interesting flares when I go out and eat richer foods, even though they may be highly regarded restaurants, etc. So.
Mhm. Thank you for sharing. Yeah, so I'm glad that you found things that really work for your digestion. Marissa mentioned that she's been reducing sugar, and Nicole mentioned texture modifications. Sure. So all of these make a lot of sense. We'll go through everything that has any sort of research behind it and the strength of that research, because unfortunately, sometimes there may have been a study done, but on such a small sample size that we really can't take that to be the word to follow at all times. And then I wanted to share a little fun fact. So a 2025 review looked at exclusion diets, and 26 of those patients had actually already tried one. Among the patients that had tried a diet, 51% actually reported a decrease in pain. And overall, 42% of patients identified at least one food or beverage that increased or decreased pain. But the list of what bothered people, what helped people was a very long list. So everyone is super individual. I always like to make that clear at the beginning. We all are beautiful, unique creatures, and that is where personalized nutrition and personalized approaches really make a difference, because what works for you, Tom, may not work for Marissa, and what works for Marissa may not work for Nicole. And so we all know that when we take things like medications or when we start an exercise regimen, we all react differently to things. And then these actually were specifically ankylosing spondylitis patients, that 78% of those patients believe that diet influenced their symptoms. 33% reported worsening symptoms after intake of certain foods. And these were the foods that were most often mentioned: meat, coffee, sweets, sugar, chocolate, citrus fruits, and apples. Any of you have any sort of reaction to any of those foods? I know, Marissa, you've been reducing sugar, so perhaps those sweets and added sugars were bothersome for you. Tom, you notice sweets too? Yeah. Yeah, sweets for sure. They're not great for us. And unfortunately, a lot of processed foods have tons of added sugars, even in things that don't taste sweet. So it can require being a little bit of a detective, looking at those nutrition labels. And then a couple more facts, that some people have also tried fasting, and some people have tried lacto-vegetarian or vegan diets, and we'll talk about those too. So just a reminder, my name's Tanya Freirich. I am all over the internet, Instagram, TikTok, Facebook, as the Lupus Dietitian. And the reason for that is that I actually have lupus myself. I've been diagnosed with lupus for more than 11 years, but have now had, time flies, 25 years of other autoimmune diseases. So the first was diagnosed a long time ago, And, with autoimmune diseases, you get one, and then maybe you get another and another. So when I was diagnosed with lupus, that's when I decided, you know what? At that point, I had already graduated with my master's, become a registered dietitian, had been working for a couple years, that perhaps there was something beyond just a general healthy diet. Maybe there was something specifically for lupus that I could implement. And that's when I saw a huge improvement in my symptoms and flares, and was really able to see how much better I could feel on a daily basis. So, with that information, of course, my experience providing nutrition counseling, in the last years, I've focused all of my private practice on autoimmune disease so that I can help other people, not only with lupus, rheumatoid arthritis, ankylosing spondylitis, really realize how much diet can play a huge role in their autoimmune activity or their inflammation. And of course, I love to advocate for autoimmune research. I love to educate with all of the research that I know and can share. So today we'll talk a little bit about AS, talk a little bit about how nutrition can help, in anti-inflammatory diets, and that is a lot. There's a lot of options out there. So the pros and cons, what they actually mean, and what's the research behind them, dietary do's and don'ts, and next steps. So this one I thought explains it absolutely the best in terms of spondyloarthritis and then ankylosing spondylitis and the different other conditions. Because sometimes when you're looking it up online, especially trying to explain it to caregivers, loved ones, I imagine that that can be really difficult. So I just love this picture because I feel like it makes it so clear. And of course, this is from the Spondylitis Association of America. Great graphics on that website. So I just wanted to put that out there as if you are struggling to explain it to anyone in your life, maybe this picture could be helpful.
That's good.
So the risk factors for AS, testing positive for HLA-B27. And we're going to talk about this a lot because it has a lot to do with our gut microbiome, and that's something that diet plays a big role in. Now, most people that have AS are positive for it, but not everyone. And then if you have a family history of AS, or if you've had frequent gastrointestinal infections and microbiome changes, these are all risk factors for AS. So this is a lot of text because I wanted to be sure that everyone could, some people are auditory learners and some people prefer to be visual. So what's the deal? This Klebsiella is a specific bacteria in our digestive tract. It's not necessarily a bad thing. And then HLA-B27 is not necessarily a bad thing, but there's a fair amount of research that's looking at how these two interplay with each other. So the genetic trait is something that just we're born with. One in every 14 people in the US has it. But specifically, more than 90% of AS patients have this gene positively. This has increased the odds for people basically times 100, so 100-fold increased risk. So there are people out there that are positive for this gene and don't have AS, but we really see that it correlates very strongly with it. So what does it even do? It helps a lot of things. It helps things called T lymphocytes. It's a white blood cell. We don't have to go into a whole lot of detail about this. I know it gets really detailed, but these T cells can also recognize antigens that are present in bacteria. So what they have also found in a lot of AS patients is in their stool samples, they have very high amounts of this bacteria, Klebsiella. And that information is going to inform one of our diets later on. So the gut microbiome is extremely complicated. And honestly, I think we're going to be researching it for centuries to come because there's so much that the bacteria helps our body do. We produce hormones, control our metabolism, control our appetite, determine how we digest foods and obtain nutrients. So there's so much to learn, which is so exciting, but also can be kind of complicated. So a little bit more about AS. I did want to put just a little bit of information. Of course, it's the inflammation of our spinal joints in the early stages. It could also include symptoms of having a light fever, loss of appetite, general discomfort. It presents differently in women than men. So some women may find the pain more at their neck than in their lower back. Some people can have mild to moderate anemia. So in a little bit, we're going to be talking about some of the nutrient deficiencies that are common with AS. And so please obviously take notes, have your questions, but some of those would be worth asking your doctor about. Hey, can you run these labs and just make sure that I'm not deficient in X, Y, or Z? Severe chronic pain and discomfort, fatigue, and then, of course, may progress to ankylosis and then uveitis. Lungs and heart can be affected rarely. And then this one also has a lot to do with our digestive tract. Some people experience bowel inflammation, IBS, or even IBD. So IBS is inflammatory bowel syndrome. IBS is inflammatory bowel disease. So IBS is kind of poorly differentiated, poorly defined, whereas IBD is perhaps Crohn's, and that also has a lot of association with AS. So who's affected? Younger people often, so between the ages of 17 and 45, which is not usual of other arthritic diseases. Can also affect children, those are much older. So it's not exclusively 17 to 45, but hopefully when people are diagnosed with the onset of their symptoms, it is a little bit earlier. The Center for Disease Control now estimates that at least 1.7 million adults in the US have AS, but a much larger group have some form of axial spondyloarthritis. And then the average time to diagnosis, unfortunately, is 7 to 10 years. So in another little break, I want to make sure everyone's awake. What symptoms are you experiencing most often as our first question? And do you have any digestive issues?
Welcome to unmute since it's a small group.
Yeah. And then Thomas, you wrote down what's fascinating and highly correlative is when I have a diet that results in large gas production. I would experience quite immediately aches and pains. Yeah. So that to me sounds like your digestive system isn't very happy, and then that is spreading to the rest of your body. Uh-oh. I think you're trying to type something and autocorrect is not having that. I see that you're. Oh, and Nicole, you mentioned you're diagnosed with IBD. Yep. Bloated. Oh, yeah, sure. Being bloated is so uncomfortable. Yeah, so both of you are noticing, and Marissa, you're noticing some of the symptoms as well. But Nicole and Thomas, so you're noticing that your GI symptoms are coexisting with your AS. Thank you so much for sharing. And as we go, please, again, feel free to add in the comments. Fatigue, yeah. Unfortunately, when we have a lot of inflammation in our body, I find this amongst so many autoimmune diseases that we feel fatigue because our body's just, it's working very hard and not thriving. Exactly. That you drop things when you're having a flare up. Yeah. So maybe a little bit of that muscular control is difficult. Okay, thanks everyone for sharing. So this I always like to bring up because we are not in the silo of my digestion is separate from my inflammation and my movement doesn't affect the other things. It's all connected. Now, the nutrition, we worry about those things that are triggering pain. We think about what could be helpful. Movement is Oh, Nicole, that's okay. We are going to talk about nutrition, autoimmune diseases. Honestly, a lot of the things that I will bring up will be helpful in terms of reducing inflammation overall. So movement, that is, yeah, you're welcome. Something that really can be super helpful for our joint health. Of course, movement really helps us be mentally in a much better place. We've all been feeling our worst and kind of stayed at home, and that's not great for anxiety or depression. Also, stress management, getting outside, being in nature, moving our body can be super helpful. Support, of course, our medical providers, friends, family, support groups like the one we're in right now is so important for our holistic care. And then environment. We, of course, want to reduce exposure to pollutants, chemicals, stop smoking, have less alcohol intake. All of these things help reduce inflammation in a holistic manner. I wanted to include this because I am not the expert in exercise. I am not a physical therapist nor a personal trainer, but this was a really interesting core set of recommendations, and it includes a lot about exercise and how you hold your body. Honestly, again, applies for everyone, but you can see, uh-oh, one of these didn't show up. Let's see if I can make it happen. Oh, okay. Well, we won't talk about it too much. But on the left-hand side, there is supposed to be a picture, and it's basically talking about keeping good posture, tips for those sorts of postural changes that can help with your AS when you're walking and driving and at work. So we'll continue on. So how can nutrition help? Obviously, if we are struggling with weight, being overweight, obese, dietary changes can play a huge part there. Cardiovascular disease. So I can speak to lupus most passionately, but for example, having lupus puts you at greater risk for cardiovascular disease. Same with AS. Unfortunately, that inflammation affects our heart health as well. Food intolerances, allergies, and there's one really interesting study that I'm excited to share with you all, improving our nutritional status. So there are quite a few things that unfortunately we can be low in when we are in a very inflamed state. And then we'll talk about gut microbiome. I probably included too much, so we'll breeze over that one. And I wanted everyone to hear about this case study. Now, keep in mind, this is one person. They did a case study on one person, but it was pretty interesting. So it was a 38-year-old person. She has AS, and she wasn't experiencing any improvement with the NSAID. And then she tried a medication, but had to be off of it. And she started taking these supplements. These were more like Chinese medicine, and adopted a dairy-free, gluten-free, and sugar-free diet. And this is what's exciting, and what maybe gets everyone excited about thinking about diet is that
I think Tanya froze. Is it just me?
Yes, yes, she froze.
Okay. Well, give her a minute. Um, uh, I know some. Oh, Cardi, welcome. Are you also in the Seattle area? You're on mute. Yes, based in Seattle. Awesome. Yes.
happened. I'm so sorry.
No worries.
Just disappeared for a second. Well, I have my presenter window, but let me get my other window up so you all can see everything.
While she does that, folks, John and I do one or twice in-person meetings in Seattle, Bellevue region. So do sign up to our mailing list so we can all meet each other, have a cup of coffee in person.
And I'm just going to add, I have to apologize. I can't get my video to work today. So I'm in the background.
I'm not sure where I cut out because I was just talking and talking until the very last moment when Zoom restarted. Jen, when was the last thing that you heard?
I think you say keep in mind this is just one case study.
Oh, sure. Okay. So, yes, we haven't even gotten to the juicy stuff yet. So, this is one case study. So, everyone, please do not think that if you copy this, that you're going to get exactly the same results as one person. But it was a woman that tried different medications, was seeing some improvement, but not radical. Then she did change her diet, dairy-free, gluten-free, and sugar-free, as well as added some Chinese medicine, supplements, and found that her inflammatory markers normalized after 2 months, and her MRI revealed notable physical improvement. So I just like to reiterate that diet can be a very miraculous thing that really can implement huge improvements in your inflammatory markers, which is so exciting. So let's chat about overweight and obesity and how it interacts with, honestly, inflammation overall. So, the higher BMI is associated with higher disease activity over time. So, we do want to, if we can, reduce our weight. Obviously, a lot of times people have been on steroids, you gain weight that you didn't really mean to, you weren't even really changing too much. Also, having a lot of inflammation often makes it even harder for people to lose weight. Also, there is a study that looked at the high prevalence of central obesity, so around our waistline, most notably among women, and that it did cause a greater impairment of functional ability and a trend towards worse disease activity. So, diet can be really helpful in getting that weight down and reducing our disease activity as well. Here are some of the nutrient deficiencies that were found to be very well correlated with AS. And actually talking about other autoimmune diseases, for example, lupus and RA, vitamin B12 and vitamin D can be low in all of these diagnoses and disease states. Lupus, for example, when our vitamin D is when we're photosensitive, we're usually avoiding the sun, our vitamin D gets lower and lower. In the case of AS, for example, vitamin D, B12, folic acid, iron, and calcium were found to be lower. These, for example, so B12 and D are super easy for any of your doctors to run a lab and check. Same with iron status to just rule out any anemia, because if you're feeling a lot of fatigue and you're also iron deficient, that can kind of exacerbate that fatigue. So, contributors to inflammation. I love this because I feel like it helps us think about how these all intertwine. These are a long list, but we could have triggers, for example, like gut infections or inflammatory foods or exposure to any sort of pesticides, chemicals, endocrine disruptors. Those all can contribute to inflammation. Then we have the stressors, whether it's emotional or physical or trauma, leaky gut. We're going to be talking a lot about that because there is so much interest in how it associates with AS and other autoimmune diseases. But leaky gut can be exacerbated by different medications, inflammation, infections, a low fiber diet, a lot of alcohol, and then our gut microbiome again. So when we have that low fiber diet, our gut microbiome gets to a worse place. That can lead to leaky gut. And then deficiencies. Of course, if you've got not a great diet, those deficiencies can add up, especially if your gut's very inflamed, then you're not really absorbing as much of those nutrients as you should. So I will keep this brief because the gut microbiome is so detailed and so interesting, but pretty detailed. So basically, what is the gut microbiome? It is the collective genomes of all the microorganisms that we have in our digestive tract. So there's thousands. The actual number is almost as high. Well, exceeds the number of cells in our body. And it's very interesting because even an analysis of two twins living in the same home, there's variability, even though they have the same genetics, they have presumably the same exposures, but we are very, very individual. It's even more individual than a fingerprint. So our gut microbiota can affect how we metabolize foods, drugs. It can affect our depression and anxiety. It shifts during the big life changes like pregnancy. It shifts as we age. It actually shifts according to our geographic location as well. So they've done studies on people that lived elsewhere and then came to the United States, and their diversity completely changes. And we know that there's a strong link between our dietary patterns and our gut microbiome, the profiles. And there's different profiles. But when things are askew, if things are not in the ideal place, it can also affect our weight, how much central obesity we have, our fasting glucose level, so basically fasting blood sugar, and so much else in terms of our cholesterol, our insulin resistance. And as I said, immigrating to the US was shown to reduce gut microbial diversity. This one was just a pretty big study, more than 1,000 people, that found that certain bacteria were associated with a higher quality of life and improved mental health, while others were very low in cases of depression. So it really is a coexistence with our gut microbiome, and we want to feed it so all the good ones that are really helpful can flourish. Here's a couple different types, just different examples of how certain ones that are very high can associate themselves with IBS and IBD. Now, in AS, here's some examples. That Klebsiella has been something that's been a very, very interesting topic. People are researching it. They're trying to figure out how that associates with AS, how it associates with Crohn's disease. And we'll talk about the low starch diet that may help reduce that number. But the gut microbiome can also be altered with probiotics, how we eat, and even how we exercise. There's so much that affects it. And then some of these, for example, the bacteria produce something called short chain fatty acids. And these are helpful because they actually help reduce inflammation. Certain patients with RA and AS have low levels of certain probiotic bacteria that are actually really helpful for our immune system too. And here, so postbiotics, if you've heard that term, is basically talking about the byproducts or the metabolites from the bacteria and the viruses and the fungi that are in our digestive tract. So those short chain fatty acids are helpful. They basically help with so many of the metabolic signaling, the hormones, metabolism. So when we have a very low microbial count, and especially of the good ones, and a very high number of the not great ones, certainly that could be found in cases of food poisoning, or having just terrible digestion, a lot of bloating. SIBO, for example, is a small intestinal bacterial overgrowth. So these are all signs that something is amiss. But it also causes more inflammation. It can cause our gut lining to not be as strong, and that can lead to leaky gut. And that's when proteins that are too big are coming through our gut lining and basically activating our immune system. And we don't want that. We do not want our immune system overreacting to things because they're really bypassing where they should be. So what is leaky gut? It is that compromised epithelial barrier. So we have our skin, and that's facing the outside world. But our entire gut lining is actually another huge surface area that kind of faces the outside world. We're eating things, we're drinking water, and consuming things from outside that our body has to figure out, is this an enemy or is this a friend? And so unfortunately, sometimes our immune system, when it's already in overdrive, starts overreacting to all sorts of things. That healthy gut flora is important in maintaining the intestinal barrier. So this one's kind of a funny example, but there is one bacteria called Akkermansia, which sounds like either a magic spell or a dinosaur, whatever you think of with that bacteria's name. But basically its job is to kind of eat the mucus lining of our gut, which tells the cells to produce more. So when people are very low in akkermansia, they have a lot of difficulty with food. They find that they're really sensitive to certain things. And then when they are able to bring it back to a normal level, they find that they can tolerate things that they didn't tolerate in the past. So it is amazing how much the bacteria helps or can hurt us. So for example, beneficial probiotics like lactobacillus, bifidobacterium, those are two like big families of probiotics, can limit the development of autoimmune disease. So what contributes to leaky gut? Unfortunately, a lot of things. So medications, inflammation, infections, certain foods that your body might see as inflammatory, not having enough fiber, high saturated fat intake, chronic alcohol, some of those things that I mentioned before, and that high sugar. So y'all already almost knew, sugar is something that doesn't agree with me, and it may be contributing to digestive distress. So reviewing this slide again, we talked a little bit about overweight and obesity. We talked a little bit about gut microbiome. Now we're going to be talking about how to improve nutritional status. And again, this applies for so many people and so many different autoimmune diseases, as well as the food intolerances and allergies. What sort of research we have about that? So for anyone out there that just wants to dip their toe in the water of, I'm going to change my diet for a better amount, this is where I would say, let's start. So start with a plate that has 50% veggies, 25% protein, and 25% starch. This is like the easiest thing you can get started with. And why I say this, and notice there are many different cuisines. You can literally put whatever cuisine you enjoy, whatever you grew up with, whatever you want to eat that night in this formula. The reason why this is beneficial is that 50% of the plate being vegetables is a great way to get to the servings of vegetables that you need in the day to increase your fiber and to increase the amount of antioxidants that you're getting. So that helps reduce basically oxidative stress, which we don't want. Inflammatory diseases, immune-mediated diseases, autoimmune diseases produce a lot of inflammation. There's a lot going on. So we want to reduce that as much as possible. And you can, of course, down here, this one's a vegan example. You can really do so much with that formula and see an improvement in your digestive health and in the variety of foods that you eat. Now, if this feels like, oh yeah, no problem, I'm already doing this, what else can I do for my health? Then I would say the next step would be to implement heart healthy choices. So for lupus, for other autoimmune diseases, for AS, unfortunately, cardiovascular disease you're at increased risk for it. So people with AS have a twofold higher risk of heart disease than controls due to the disease itself. So what can we do about it? We want to reduce our salt. That helps control our blood pressure, helps reduce fluid retention. We want to reduce our red or processed meat intake. Honestly, processed meats just have a lot of additives as well. They're really not great for our gut health, and they're a source of saturated fats. Reduce trans fat. Thankfully, that's one thing that we all realized in terms of the food industry. Ooh, that is not helpful for us. So they've also tried to eliminate it from our food system, but it's still in foods and it is terrible for our heart health. We do want to increase our fresh produce, choose lower glycemic index and higher fiber foods. So examples would be brown rice instead of white rice, a whole grain instead of a refined grain. So like, let's say if you're having quinoa instead of something like a refined pasta. So you can find things with more fiber that is unprocessed, and that doesn't raise your sugar as much. It helps you feel full longer. And with that fiber, that feeds the good bacteria. Definitely we want the omega-3s. And that could be salmon. If you don't like fish, you can have it from ground flaxseed, chia seeds, walnuts, almonds. Now, I do want to dig into some of the diets that people ask me about the most. So first and foremost, keto diet. This one is characterized by a drastic reduction in carbohydrate intake. Sometimes people think they're on a keto diet, but they're actually not. The actual definition of a keto diet is all the way down to something like 50 grams of carbohydrates per day, which honestly could be found in one bagel. And that means that you have to eliminate all the carbohydrates from veggies and fruits. And so it's very hard to adhere to it. And the fat has to be a super, super, super high amount. So about 70 to 80% of your calories are coming from fat. So a lot of people feel a lot of digestive distress on the ketogenic diet, and it's hard to follow. So sometimes people are on it short term, but they find it's overly restrictive. There was only one study that I could find that related ketogenic diet to any sort of benefit for AS. I usually don't recommend it because I find that people then overload themselves on things like cheese, butter, bacon, and honestly, that's not great for us for so many ways. So many reasons. Now, the Mediterranean diet, that's actually gotten a lot of traction behind it in terms of specifically for AS, but a lot of other autoimmune diseases as well. The Mediterranean diet is mostly plant-based, including fish more often than red meat. Trying to do unprocessed food as much as possible, olive oil. Honestly, it's pretty delicious and it's a little bit less restrictive than some of the others. But the focus is variety, having lots of vegetables, legumes. And so that can be something that's easier to follow and a great way to increase your antioxidants. Some people ask about the autoimmune protocol. This one is a tricky diet because it is very, very restrictive. The goal is at the beginning, you're really paring it down to the absolute basics. But in that paring down, you are finding that it heals the gut. That's the goal because you're getting rid of any potential triggers. And then you're reintroducing to see what actually bothers you. I would not recommend that to anyone that doesn't feel comfortable basically preparing all your foods at home for 6 to 8 weeks and maybe someone that's traveling a lot, that would be really, really hard to follow. But if you are having tons of digestive distress or tons of symptoms and you really want to figure out what foods are bothering you, that is a way to go for sure. Now, vegan, vegetarian diets, these all have merit in terms of we are getting in more plant-based foods, which is fantastic, and reducing some of the things like red meat, processed meats that we know they shouldn't be consumed in excess. However, sometimes people follow a vegan diet and they're eating all processed foods. So the goal is to eat unprocessed, fresh things that will really help reduce that inflammation. And you can do it in any sort of way, of course, respecting your culture, your history, ethics, if it's regarding eating animals. There's ways that you can implement all of those things as well as the diet that's best for you. So the Mediterranean diet, just a little bit more about this and some of the research. So it was linked to reduced disease activity, improved cardiovascular disease, and it's known because of high consumption of olive oil, unrefined carbohydrates, fresh and dried fruit, veggies, fish. They even include a little bit of red wine, not too much. Now, this low starch diet, this is specifically for AS, and I'm not saying that this is the right answer. This is one of the things that has been researched amongst many. This one was associated with reducing that Klebsiella, which has been associated with AS. A reduction in this bacteria reduced autoimmune activity. However, there was a 2022 study in Portugal, and the results haven't been published yet. The other studies you can see all below are a little bit older. So one was 1996, one was 2006, and we really obviously would need just more people, more studies. Ebringer is the researcher that really advocates for this, and he has been implementing this in his patients for years and years, but unfortunately can't really report on precise figures. So it's one doctor that has seen, hey, this can be really helpful. And it's certainly not super drastic of a diet in terms of reducing that starch intake. We really shouldn't be consuming a whole lot of flour, a whole lot of sugars. And this other researcher did find that basically those indicators of disease activity were increased by every milligram of ingested starch. So there are doctors looking into this, researchers looking into it. So it may be something worth asking your doctor about or thinking about. Hey, do I feel good when I eat a lot of refined carbs? So those would be, for example, like potatoes, breads, rice, certainly desserts, lots of sugar. And if sometimes you're noticing, hey, when I consume a lot of sugar, I really notice the pain uptick, that may be worthwhile to keep in mind. So here's what most of the research supports on things that are unhelpful. So high saturated fat intake, so that would be like butter, bacon, animal fats, basically. High salt intake, ultra processed foods, honestly, are really not healthy for anyone. They usually have a lot of additives. And what do I mean by ultra processed foods? I mean things like candy, things with food colorings and food preservatives, sodas, something like, a fast food burger that for some reason they've done examples of this in the nutrition space where they leave it out for months and months and it never molds because it has so many preservatives. Things like that are shelf stable for a really long time, and the ingredients list is full of things that you don't know how to pronounce. That's usually an example of an ultra processed food. TV dinners, like the frozen TV dinners, where it's got tons of additives, are another example. Certainly excessive alcohol. I think all of us know that that's not great for us. Excessive sugar, gluten and dairy, a high starch diet. So lots of sugar, lots of refined carbs, artificial sweeteners are really detrimental for our gut health. Now, I saw on multiple places that MSG is something to be wary of for AS. However, I didn't find any research that pertained specifically to AS. Now, MSG in general, the reason that we want to avoid it for most people, most of the time, is it just can cause a little bit more oxidative stress and it's high in salt. However, it is an ingredient that if you have it every once in a while, it's not the end of the world. I think it really got demonized for a while. And I don't want anyone to have a lot of anxiety about consuming it every once in a while. It often would not make too much of a difference. Now, there was one study that I thought was really, really interesting, and it actually did an allergy test. So there's different types of antibodies that we have, an allergy versus an intolerance. And some people with AS were found to have like low level allergic response to things like red meat and pork and crab. So I put a question mark because it's one study. And you can see it there. I cited every study that I mentioned. But those were people with AS having basically an inflammatory response in the form of an allergy to these sorts of proteins. And then I put in more information about it here. So it's the IgG is a food allergy. If any of you remember some of your labs, maybe you've looked at IgA before, IgM, but IgG is a food allergy. And so it is an interesting thought from these researchers that perhaps alpha-gal, which is an antigen, could be a part of this. But I wouldn't take this again as gospel of, oh, every single AS patient should avoid these foods. Because it was a very small sample size and it only looked at C-reactive protein or CRP. But keep it in mind, if you have been trying to pinpoint things that are bothering you and you couldn't, Well, maybe for you it is one of these things. So just pay attention next time you're consuming it if you notice any uptick in symptoms. Dairy has been found also for most like autoimmune populations. Some people do have a little bit more of an autoimmune reaction to it, that IgG. And then this study in particular looked at, again, a small sample size, looking at people with AS. And after 6 weeks, cutting it out, 52% reported a good improvement. And then 62% of those were able to stop their NSAIDs. So that's exciting. I've found in other autoimmune populations like lupus that people find that their skin clears, that their digestion improves, and sometimes people find that their congestion, like sinuses, feel clearer when they cut out dairy. Now, gluten, I don't want to scare people, but there's definitely a fair amount of research specifically about the type of gluten that's in the United States. Ours is often genetically modified and been altered to grow in a little bit of a different way. So that increased the amount of gluten in our wheat. And there's unfortunately a fair amount of research about the antibodies that we produce against this, and that many people that are not celiac still are having a gluten sensitivity or a gluten intolerance. It has been shown to increase leaky gut even in people with no medical history. It does promote gut dysbiosis and it induces oxidative stress. So it's something to think about as well. Specifically in the world of AS, this study looked at people that did not have celiac. Out of 110 patients, 79% saw an improvement with a gluten-free diet. And out of those seeing the improvement, 96 experienced a worsening when they did ingest gluten later on. So they reintroduced it and then they said, ooh, I didn't really feel so great. And that was 96% of them. That can be in bread, cookies, crackers, beer, cakes, soy sauce, breading, flour, tortillas, and sometimes, unfortunately, even in our medications. And here's a whole bunch of studies that we don't have to really go deep into, but basically what sort of impact gluten has. Now let's talk about helpful changes. So these are things that we want to incorporate more of. So for example, omega-3s in the form of fish oil has been shown to be really helpful to reduce inflammation, and that's across so many autoimmune diseases, but particularly AS. A high intake of unprocessed foods. So plants, that could be veggies for sure, fruits, nuts, seeds. Some people do really well with legumes like beans, lentils, chickpeas. Some people find that's a little hard to digest, and we don't want to go from zero fiber to very high fiber. We want to gradually increase it. Mediterranean diet has a fair bit of research behind it. There are some studies that looked at caloric restriction or fasting. I always say, please, please, please do that under medical supervision, because for anyone out there that maybe has a little bit of trouble controlling your blood pressure or blood sugar, that could be quite dangerous to go too long without eating. So talk to your doctor about it, talk to a registered dietitian. Increasing our vegetables, plant-based diet is fantastic. And notice that I say both plant-based and unprocessed, because you can get, for example, like a nice soup that has like beans and veggies and everything is a single ingredient that you're putting together. Or if you're trying to do maybe a plant-based diet, you could get a very processed, like vegan burger patty and a refined grain burger bun and add in things that are very processed. And both are eating more plants, but one looks like a much shorter list of ingredients than the other. We definitely want to promote our gut health. I know I talked kind of big picture about how important those gut bacteria are for us, but in terms of what we can do day to day, you can have things like bone broth, collagen, pre and probiotics, more fiber in our diet, and then fewer additives. There is some research about turmeric that I'll talk about that can be helpful. And then green tea. I saw a fun study that was just in mice that the component in green tea, EGCG, can actually inhibit inflammation and that newborn bone formation in mice. So good to know. And green tea is delicious. Omega-3s. So why are they helping us? They reduce the inflammation, the disease activity scores, and the stress, the oxidative stress that we really want to keep down. This was mentioned by a lot of different studies and proposed in a lot of different ways. That core set of recommendations that also mentioned including more fish and omega-3s. Turmeric. So it has been shown to reduce IL-17 production. That's more prevalent for lupus, and IL-6 production, which is more relevant for AS. And this study looked over 4 months. But again, some of these studies are really small. So unfortunately, we don't have unlimited amount of researchers and money to dedicate to all these things, but it is food for thought. But it improved Treg cells and also the reduction in the IL-6. That's an inflammatory cytokine. So those helpful additions in terms of our vitamins. So we do want to think back to that other slide, and I rewrote it here, but calcium and vitamin D, especially if you've been on a lot of corticosteroids, you're at greater risk for things like osteoporosis, osteopenia, and you do want to talk to your doctor, of course, about how to do that safely, what dose is appropriate for you. They can certainly check your vitamin D level. And while the range of normal is between 30 and 100, it would be better to be sort of in the middle of that range. Those omega-3s that we were talking about, and those could be found, again, ground flaxseed, chia seeds, salmon, sardines, tuna, olive oil, avocado oil, and antioxidants. So that can be fresh fruits, fresh veggies, sources of vitamin C, because AS patients were found to have lower level of total antioxidants and higher level of oxidative stress. Vitamin B12, please ask your doctor. That's another thing that's really easy to check. And it's something that as we all age, we don't absorb as well. So we do want enough of that. Both being low in vitamin B12 and vitamin D can make fatigue worse. Folic acid and then iron deficiency can also make us feel really tired and worn down. So that's an easy thing to ask about. And just to wrap it up, and then we'll go through Q&A. If you are interested in nutrition help, one-on-one counseling, learning more about how I can help you, or honestly, if you're just curious, please reach out to me. You can reach me at my email address, and again, on any social media, Facebook, Instagram, TikTok, you can find me as The Lupus Dietitian or my website, thelupusdietitian.com. I can't wait to see these questions. I didn't get a chance to look at them at all while I was chatting, but let's see. Let me scroll to the top. So Thomas is asking about a particular medication, its role for being a painkiller or an antibiotic, and also an antibiotic. I am not going to be that expert that can tell you about that. I think we should ask a pharmacist, a rheumatologist, because I'm not sure of that answer, and I certainly don't want to misspeak. Someone else is asking, does using a blender impact fiber content of foods? So actually, even though the fiber is now cut from long strands to short, because obviously it's cut into small pieces, you're still getting that fiber in. In terms of feeding your gut microbiome, it's still legitimately there. In terms of you feeling full and satisfied because the food physically stays in your stomach longer, that's what's impacted the most when it is in a blender. So, at that point, it's kind of a thick liquid, so you can digest it pretty quickly. It's kind of like a pass-through food because your stomach doesn't have to work too hard to break it down with stomach acid before it goes on to the next place. So unfortunately, you may just need to be a little bit more careful, for example, of how much fruit you put into those foods, because when you chew it, let's say you get the pieces to here, but when you blenderize it, those pieces are tiny, tiny. So it can make your blood sugar spike a little bit more. Even though the fiber is there, it's still going to feed the good bacteria. So that's a great question. Marissa asked, is there a way to test your gut bacteria levels? Absolutely. So that's actually one of the tests that I do with my clients. There's many gut health tests out there, but it is amazing to see which things are out of range, how it correlates with their symptoms, and then of course we have a much clearer answer of what direction to go. So that's definitely something that you can do to see what is going on with your gut microbiome. So yeah, great question, Marissa. I definitely recommend it too. Nicole says Mediterranean diet has been recommended to you the most often as an IBD patient. Yeah, for sure. I think the Mediterranean diet just has so much research behind it that doctors feel very comfortable recommending it. It also makes sense. You're including more unprocessed foods, you're cutting out processed foods, more plants, olive oil. So these are things that have been shown to be beneficial. I think on top of the Mediterranean diet, sometimes we can even go further and see even better results. Um, but I hope your IBD has not been bothering you. Carly asked, gluten-free has been really great for her digestive system. Oh, you're going to Europe next week. That's nice. Congrats. You're really curious if the gluten products over there settle with your digestive system better. So I will say I've had a lot of clients that say when they travel because of either language differences, difficulty in communicating, or just by accident, they've had something that contained gluten, even after being gluten-free for a very long time, and they find that they do not get the reaction that they do in the United States. Now, of course, that is not a research study, that's not data points, that's just people telling me that's their experience. So if it makes you feel awful, I would not go out of your way to get gluten. But if you did want to try it and you feel like you can continue on your travels without a major health crisis, then of course, free will, you can do what you want. It's been hard to figure out how the Mediterranean diet or no starch diet mix with gluten-free as well. Yeah, so gluten-free can coincide with those. Um, Low starch, we would just focus on all of the other foods like complex grains. So maybe you would have something like quinoa, but in small amounts. Um, Mediterranean diet does use whole grains. So you're welcome to just use those kind of ancient grains, amaranth, millet, quinoa that never had gluten in them. So that could be another option. Yes, Nicole said that her friend mentioned that she was able to tolerate bread much better in Europe than the US. Um, Marissa said those were big numbers for the gluten-free diet slide. Yeah, it is. It's really interesting. But again, that was one study, so not representative of all people with AS. Um, thank you all so much for coming. And then any last questions from me? Because I do want to give you time to have your support group time as well. And thanks everyone for coming.
Tanya, this is John, and
Hi.
I just wanted to say just a wealth of great information. Thank you so much. This is really great. And uh, I just have one question myself, if I can. And
Sure.
that is, a friend of mine said, "Oh my God, you have AS, turmeric, you have inflammation, you have to use turmeric." One thing I picked up very interesting in your discussion, turmeric affects the IL-17.
Hmm.
And that is very interesting to me because I have been on TNF inhibitors and I've been on IL-17. And
Hmm.
I think the TNF is a lot more effective. And
Mm.
so I'm wondering if you take turmeric and you react better to TNF inhibitors,
Hmm.
it may not work as well. And the other part of it is turmeric can be pretty acid, it can be pretty tough on your stomach. But
Mm.
I noticed, over time that it was more stomach upset than it was
Helpful.
helpful. Yeah,
Yeah.
exactly.
So that's where always want to reiterate with people, it is so individual. Just like you react better to certain things in terms of medications or regimens, definitely your nutrition sometimes reacts better with you versus your neighbor or vice versa. So whoever told you about turmeric maybe does benefit from the mechanism of action in their body that's reflective of their inflammation. And you know, the IL-17, those research data points were from lupus studies, not
Mm.
people in AS. So I mentioned it because I have seen lots of research about it, but in AS setting, they were noticing it with IL-6. So I love that you have kind of your own personal data points of, hey, nope, this is the medication that works for me. Maybe that's what's going on in my body.
Yeah, great. Appreciate that. That's really good. That was eye-opening for me because I have been interested in both those, IL-17s and the TNFs, and that's a great answer. Thank you.
Oh, yeah, you're welcome. I also absolutely love the research and learning more and more about how these things can help people.
And I'm going to ask for any other questions from the group, and I'm going to throw in a little side note. I spent some time in Europe, and I love the bread, especially France, and it didn't bother me. And when I'm here, bread does bother me. So there you go. There's a data point for you. So I did notice that. Anyway,
Yeah, thanks for sharing.
Thank you very much, Tanya, and thanks everybody, Jin Lee. One thing that I take from this talk is that I suppose host reaction or host genetics has a lot to do with food. So you're basically maybe intimating or relaying what many people in the diet field are believing is that different people may have different reactions to different food groups, but will give the same results in terms of the same symptoms for AS. Is that correct? Is that safe to assume?
That's a great question. So, not necessarily. Some people will find, and that's actually another point that I want to make. You are all very much the experts in your own body. So, trust your gut intuition, trust your reaction of, hey, you know what? That did make me feel a little funny because your data points of, my body didn't like that are really important to take into account. But to your question, Thomas, no, not everyone reacts the same. So, for example, one sign of intolerance towards a food definitely could be increase in your disease activity. So let's say joint pain. However, other signs could be just digestive distress, headaches, feeling extra fatigue. So when one person isn't tolerating a food, they may react a little bit differently than somebody else.
Yeah, thank you very much. Because when you were talking about food allergies, and I've been looking at many of my experiences, I can't seem to separate in a very clean way the interactions and the correlations between food allergies, AS symptoms, and also the result of taking certain foods that cause bacterial growth, increase like Klebsiella and so forth. So my guess currently is that they're all interrelated and there may be some allergy um, trigger to AS. And do you have any thoughts about that?
You know what I've noticed in so many of my clients and people that I speak with in the community is that at a certain point, if your gut health isn't in a great place and you're having just so much inflammation, so much disease activity, or a leaky gut, sort of everything is just inflamed, it is impossible to differentiate of what is the problem and what is the trigger because also you may have like a long reaction time that something may bother you 2 days later or 4 days later. So that feels like we're really playing detective to figure it out. But I have found that when people do really heal their gut health, sometimes maybe need to do an exclusion diet and calm down that inflammation, then they get a lot more of clear answers. Was it a food? Was it my medication change? Was it the extra stress that I had with work or family life that then caused this change? But when it's all so inflamed, it does get very muddled. Yeah, you're welcome. Great question. And actually, when people improve their gut health, I find that the things that used to bother them, like you had mentioned, you're on a pretty restrictive diet, that they get more wiggle room, that they're able to tolerate things that in the past that they weren't able to.
Is there any more questions from the group? Well, if there's no more questions, I think we have come to the end, but Tanya, this was excellent. And I think we all got a lot of great data from this, and we sure appreciate your giving us the time and coming and presenting today. This was excellent.
Thank you so much. I'm so excited to share all the information with you, and I'm honored to take some of your evening. So I appreciate everyone that took your precious time and spent it with me.
Well, thanks again. Thanks everybody for joining. All right. Take care.